This next conversation is about consequences. The Trump administration has officially ended temporary protective status for Haitians in the United States, a top priority for this administration. Well, yesterday, a federal judge took a final step to allow the termination of TPS for 350,000 Haitian immigrants and refugees who have currently been here legally. That means they are now at risk of deportation back to a country that the U.S. says remains dangerous. The Washington Post reports a large concentration of Haitians granted TPS worked in healthcare, long-term caregiving, or other service industries, and the ending of TPS is expected to have a major impact on cities like Miami and Boston. I want to bring in Kyle Simon, Senior Director for Home Care Association of Florida, and Amy O'Daniel, owner and administrator at Bright Star Care in Delray Beach, Florida. Kyle, help us understand the impact. You already had to let go of 6 workers because of an earlier court ruling. How has this affected your facility?
Well, that's actually a provider that experienced that. I represent the statewide association. There are several providers that have had to do that, countless providers that have had to do that throughout the state. But ultimately what this is, it's about patients and continuity of care. So when a caregiver disappears, a patient does not lose an employee. They lose a trusted, trained person who helps make it possible for them to live safely at home.
Denise, even before this, we were seeing a caregiver crisis in the United States. People are living longer. There are more of these long-term care facilities. Give us a picture of what it's really like out there, because the idea that, oh, well, we've lost some workers, we're just going to replace them with others. There's Americans waiting in the wings to fill those jobs.
Right. Yeah. Florida cannot absorb a sudden caregiver loss as it is, especially in the home health sector. We rank last in the nation for home health worker availability, and we have every year since 2016. So there are just 17 direct care workers, for example, for every 1,000 adults age 65 and older, compared with 65 nationally. So that shortage is very real. So this will only compound that issue.
Amy, what's it like?
Exactly like Kyle said. Unfortunately, this to us is not political. It's about patient care and access to health care. And with the aging population, especially here in South Florida, we can't afford to lose anyone, let alone the approximately 4,000 nursing assistants that will no longer be in the workforce for us.
So what's it going to be like? So let's say all of these people are forced to leave the workforce. They're deported because of ICE. They're afraid to show up to work. What is it going to be like, Amy?
Well, legally, we can't hire them if they don't have TPS status and they are not available or not allowed to work. So we've had to terminate people. And that's very real, right? That affects aging people trying to age safely in place at home. That's our reality now. So we're leaving families burdened, maybe in the sandwich generation, trying to take care of their own children, work, save for their own retirements, and now they have to take care of mom and dad because caregivers may not be available to do that for them.
Are you going to be able to find new caregivers? Are there Americans waiting to take these jobs, Amy?
Absolutely not. Unfortunately, caregiver recruitment has been a challenge, quite honestly, since COVID. And now this only compounds our problems with hiring.
What do you want the government to know, Kyle, about the consequences of these actions? And have you spoken to government officials in Florida?
Yes. So my organization reached out back in January to the 30-member Florida congressional delegation, as well as our partners at the Florida Healthcare Association, which represents senior care facilities, calling for practical, lawful solutions that protects patients and preserves this essential workforce, while longer-term immigration questions are addressed in the Congress.
Amy, what is it like at your facility? Right, caregivers, long-term caregivers, especially for an aging population, they're family at this point.
They do. They come in, they become their lifeline. I don't own a facility. I own a home care agency. So we support people where they live, whether it's in their home or in assisted living, independent living, memory care. And those communities are also feeling the crunch where they've had to terminate people for TPS status. There just simply will not be enough people to care for our aging seniors in South Florida. And it should be a huge concern. And unfortunately, again, not politics, it's access. It's keeping people safe at home, out of hospitals, allowing them to age in place with dignity. And who is going to be there to do that, to help these people be safe at home?
Kyle, Amy, thank you so much for being here. It's really important for our audience to understand what the impact is right now.